Hey guys, welcome back to my channel. In today's session we will be discussing about the axis determination in the ECG, right? So in some previous videos we have discussed about that how to check the rhythm in an ECG and how to calculate the rate in an ECG, right? So the next step after understanding about the rhythm and the rate of an ECG, we need to determine the axis in the ECG, right, of some particular patient. So as we know that once we have put on the chest lead onto the patient, and we have put on the limb leads of the patient, and we are having an ECG paper right now, right? So in that paper we know that this is the rhythm, regular or irregular. We are having the rate also. For example, it is 98 per minute, okay, per se. So then the next step is to calculate, to determine the axis in the patient, right, axis in the ECG. So let's find out like how we are determining the axis of the patient. And it's very easy actually, right? You can just calculate it or determine it in just a matter of seconds, right? So let's just understand it very quickly. So guys, for that we need to know about the, I'm not going into the detail of the cardiac vectors, okay, and we don't need to know it about as well, because in the exams also and in the clinical practice also we don't need it, right? That is the kind of work of the technician, ECG technician side. So here we are going to talk about mainly the ECG, right, and how to determine the axis from that. So basically guys, this is the cardiac vector graph which we need to understand before going into the ECG directly. So guys, here what we can see is, we can see some of the leads. Which leads I'm talking about? For example, look at this one. We are going to talk about the lead number 1, right? First lead, then lead number 2, lead number 3, right? And AVL, AVF and AVR. Usually AVR we don't need to see, okay, I will tell you why. So basically we will be dealing with the 5 leads which we need to remember for the ECG, for the axis determination in the ECG, right? So for the ECG we need all the leads, but for the axis determination basically we need to actually look into the 5 important leads. These are the 1, 2, 3 AVL, AVF, right? Once you understood this, second step is, you can see that in front of the AVL they are mentioning minus 30 degree. In front of the first lead they are mentioning about 0 degree, right? Yes. So these are the angles, or you can say these are the degrees basically, right? And what we need to know is that between minus 30 degree and the plus 90 degree, I am saying between minus 30 degree and the plus 90 degree, you can see that this is the purple color, and in this purple color this is kind of a safe zone for the patient, right? Rather I would say that between the 0 degree, between the 0 degree and the 90 degree, this is the safe axis for the patient. This is the normal axis of the patient. For example, you will be undergoing the ECG, right? You will be also having some kind of axis, right? So if I will determine the axis, normally you will be having the axis between the 0 degree and the 90 degree, or I would say you will be having the axis between the lead number 1 and lead AVF, right? So this is the normal QRS axis. This is the normal axis, right? Now if somebody's axis, if some patient's axis is falling between the lead number 1 and AVL, I will tell you in detail like how to go into the ECG, how to check into the ECG. So if somebody's axis is falling between lead number 1 and the AVL, that is called as the leftward axis, which I wrote over here as well. That is called as the leftward axis, right? If somebody's axis is falling between the lead number 3 and the AVF, then we will call that as rightward axis, right? Likewise, if somebody's axis is falling between the lead number 3 and, let's say, lead number 3 and lead number 1, so we'll say that it is going towards the rightward axis, right? So it's like that. So basically in terms of degrees, I would say between 0 to 90 degree, right, that is considered as normal axis, right? Between 0 to minus 30, that will be considered as 0 to minus 30 degree, that will considered as leftward axis, right? Likewise, you can see that between minus 30 to minus 90, that is called as left axis deviation, LAD. Likewise, between minus 120 to 180, that is right axis deviation, RAD, right? And if somebody is just falling between like minus 90 to minus 150, right, that is called as extreme axis deviation, or some people call that as northwest axis deviation. But guys, this is very rare. If you are working in a hospital, you might be working in the emergency or casualty, or you might be working in the ward, or you might be working in the critical areas, for example ICU or HDU. So in these places, hardly you will be finding some kind of people's ECG are having the northwest axis deviation or the extreme axis deviation. So usually you will be finding that some people might be having normal axis deviation, some people might be having the leftward or rightward axis deviation, or some people might be having the left axis deviation or the right axis deviation, right? So usually we don't see the northwest or the extreme axis deviation. That is kind of a rare thing. So here we need to deal with which kind of leads basically, guys. So we need to look into the lead. I'm highlighting those leads. Lead 1, lead AVL, lead number 2 AVF, lead number 3. What we need to memorize over here is that between the 1 and the AVF, usually the patients are having normal axis, normal axis, normal QRS axis. Between the 1 and AVL, that is the 0 degree to minus 30 degree, that is the leftward axis. Between the plus 90 to plus 120 degree, that is the rightward axis, right? At lead number 1, there is a 0 degree. At lead number 2, 60 degree. Lead number AVF, plus 90, right? Lead number 3, plus 120, right? And the AVR is having the minus 150, right? So that these are the positions. Now, on the basis of this cardiac axis diagram or cardiac axis graph, I'm just going into the ECG papers, right? So if you are having an ECG in front of you, right, then how to determine axis? Very, very easy, guys. So just look over here. Let's talk about the first ECG, right? And what you need to do is that after watching this video, just take any ECG and try to find out the axis, right? Okay, so let's say this is some patient ECG, right? So what we need to understand is, I told you the leads only. So first focus on the leads. Lead number 1, lead number 2, 3, AVL, AVF. AVR is for, I told you northwest axis or the extreme axis deviation, so we don't need to worry much about that lead. So 1, 2, 3 AVL, AVF. 1, 2, 3 AVL, AVF. These are the leads which I'm going to focus upon if I'm looking into the ECG for finding the axis. Okay, right. So what we need to do is, now once we know the leads, I need to look into what? I need to look into the R wave and basically the height of R wave. So if I will see over here the height of R wave, if I'm considering about, I need to count the number of small boxes, or for an idea you can count the number of large boxes as well, right? So how many large boxes the R wave is actually covering, or exactly to be very specific, you need to count the small boxes. Okay, so here I am seeing that basically I need to compare which two leads are having the maximum R wave height. So over here I can see the first R wave is not having that much height. It is almost having around like almost having around 5 small boxes, almost having around 5 small boxes over here, right? Let's talk about the second lead. Second lead is the taller one. So second lead is the taller one among 1, 2, 3 AVL, AVF. AVL is having very small one. I'm not considering much about that, right? And then third one and the AVF, but among the third one and the AVF is having the taller one. So second lead is having the tallest R wave, and then the AVF is having the AVF is having the tallest R wave. So I would say that second lead is having the tallest R wave, then AVF is also having the tallest R wave, right? So my axis, not mine, actually the patient axis will be falling between the second and the AVF, right? Now let's go into that diagram, guys. Second and AVF, right? So second lead is over here, yes, this is the second lead. And AVF, where is AVF? AVF is here, right? So between plus 60 to plus 90, right? Between, I can say that the patient axis is falling between plus 60 to plus 90 degree, right? Which axis guys? Plus 60 to plus 90, normal axis only. So this patient is having the normal QRS axis. Okay, let's check into the another ECG. Let's find out the axis of this patient, right? Again guys, look at the leads 1, 2, 3, AVL, AVF. Now which one is having the tallest R wave? So here I can see that AVL is having the tallest R wave, right? And then I can see the lead number 1 is having the tallest R wave. So I can see that the AVL and lead number 1, right? So here I can see the axis is falling between 1 and AVL. So accordingly, this is the lead number 1 and this is the lead number AVL. So between 0 degree to minus 30 degree. So between 0 degree to minus 30 degree, right? 0 degree to minus 30 degree. So here I would say that this is the leftward axis. This is the leftward axis. In some books, they might say this is the normal axis, but to be very specific, this is the leftward axis, right? Okay guys, so here it was normal axis only. Here it was normal axis, right? One more example guys, so that it will be very crystal clear in our mind. So guys, here also lead number 1, 2, 3, AVL, AVF. Tallest one I can see in the lead number 2, right? So tallest one I can see in the lead number 2. Then third one is having the taller, third one is not having that taller actually. I would say the first one is having the taller one. First one is having the more taller one, right? So first one is having the more taller one. So second one and then first one. So the the axis is falling between lead number 1 and lead number 2. So lead number 1 and lead number 2, let's find out. So this is the lead number 1 again, this is lead number 1 and this is the lead number 2. Again guys, between 0 to 60 degrees. So this is the normal QRS axis. This is the normal axis, right? So I don't think there will be much problem over here. So this is the between 0 to 60 degrees. So it will be having the normal axis only. This patient is having the normal axis, right? Now one more example guys. Here also 1, 2, 3, AVL and AVF. So here what we need to find out is again guys R wave. So here tallest R wave I can see that lead number 2, 3 and AVF, right? Because first one and AVL is not having that much taller wave, right? This is a very small, this is also not that bigger one, but second, third and AVF, I will change the color. Second one is having the very tall R wave, right? Almost 3 big boxes are covering, and third one and AVF is having close neck to neck competition over here. I would say it's very hard to say that which one is having the taller R wave, to be very frank, among the third one and AVF, who is the winner in R wave height. So I can't say exactly, but still I would say that okay, so third one, I'm taking third one, you might take the AVF also. So somewhere between second and third, or somewhere between second and AVF, this would be the axis over here, right? So I would say second and then third. You might take AVF also, okay, I won't fight with that, but second and third I am taking like that, because it's very hard to say that which one is having the tallest R wave, right? So if I would say second and I would say second and third, if I am saying second and third, so second one is this one, third one is this one, or you might say second and AVF also. If you will be considering that between second and AVF, then it will be coming as normal axis, and or if you will say between second and the third, then it will be between plus 60 to plus 120, so that will be the rightward axis. So I am taking second and third, so I am saying this is the rightward axis, right? So I showed you the example also guys. So basically what we need to understand, we need to have clear picture in our mind about this diagram, that is the that is this diagram, cardiac axis diagram, this one, and then we can easily find out that we need to focus upon the first, second, third, AVL, AVF. Okay, usually these are the leads which we need to focus upon. And if you will guys see that I have discussed the 4 examples, okay, and usually you are seeing that the axis, either it is having the leftward axis or rightward axis, either it is normal axis. Yes, some patient might be having the left axis deviation or right axis deviation also, but very rarely we are seeing the northwest axis or the extreme axis deviation. So I hope guys you enjoyed the discussion. I will be seeing you in the next one. Thank you so much.